Good morning. I'm very glad to be here today, and I would like to thank the organizer for giving us the opportunity to share our views with you and hopefully be back to work with some useful feedback. According to our national legislation, our unit has the responsibility to plan official control programs for food after the primary production on national level, setting priorities based on risk assessment. To do this, in practice, we have to decide about the combinations of any hazard commodity to test for, and also for the adequate number of samples in for every such combination. We have also to allocate the samples to our competent authorities all over the country. To do this, we wish we could have such a genius engine where we can just enter all our data and end up with the precise, adequate number of samples. But this is not the case. However, we do know what data we need to take into consideration, and these data include the requirements of the legislation, the kind and number of different food business operations, the quantities of food products in the market, the results of our results of the previous years, and also information from the RASP system, which is included in the RASP annual report, or other annual reports, new scientific data as well. Recommendations of the DG Sante audits are very important, as well as information from the primary sector. Also, we should take into consideration consumption data and the distribution of the population, and we take into consideration consumer complaints, any ad hoc events, as well as political or social concerns. To incorporate all this data in an equation is of high complexity. So we just thought of let's do the work the simplest way we can. And let's see what the simplest way include, what we can rely on. First of all, we have the legislation in place, and fortunately, the European Union and EFSA have done a lot of work for us. EFSA has done the risk assessment and also has published opinions, and upon them, the European Union has issued the legislation. So, to start with, we decided that we have to look almost for every hazard described in the legislation. Sometimes, legislation goes even further and gives indication about the adequate number of samples. So, for instance, pesticide legislation includes the number of and the categories that should be tested, and the number of samples, which, for the case of Greece, as well as for other countries with a similar population, is at least 15 samples for each food category. Also, the recent legislation on contaminants gives an indication on the samples that we should test, we should examine, and there is a requirement for an examination of at least 500 samples for food of animal origin in the internal market. However, we have to distribute these 500 samples to the different food commodities. To do this, we would like to have a classification. In the case of the inspection to establishments, according to our national legislation, we have determined the frequency of inspections. And to do this, we have ranked the establishments in high, medium, and low risk, these three categories. And for each one of them, we have determined the frequencies of the inspections, the periods in between we need to visit and inspect the establishments. So for high-risk establishments, we have decided that we should visit them in between 6 and 18 months, whereas for the low-risk establishment, a visit every 3 years is deemed to be sufficient. We would like to have a similar ranking for the food categories in order to be able to decide on the right number of samples. And to do this, we can rely on the results of the previous years of our national food controls. And let's see how this works by using decision trees. Let's discuss first the decision trees on the chemical hazard, like contaminants. That is, substances for which maximum levels or action limits have been set. We take into consideration the results of our programs from the last 5 years, and we rely on the non-compliances of these programs. Here, the usual situation is that there is an observation of a limited percentage of non-compliances. This is less than 5%. Usually it's about 1 or 2, which is quite expected. And in this case, we would be happy if we could just examine 20% of the samples in the market, which means that if we could avoid any duplicates, we could have a whole picture of the market in a 5-year period. In cases there were increased compliances during our annual plans, then we would like to, for this period of the whole, to have the look, a picture of the look of the whole market in a shorter period, which means, let's say, about a 3-year period, which corresponds to 35% approximately of controls in the internal market. What we do in practice is that we, in case of increased non-compliances, we increase the number of samples the next years. Then, if there haven't occurred any non-compliances in our results from our controls, we could discriminate between 2 cases. It could be that all of the samples we have tested are below the LOD value of the method, the limit of detection of the method used. If this has happened, we can decrease the number of our controls, or we may also rule out this kind of analysis for some years and come back later on. In case we have results that are above the LOD limit, we just retain a small percentage of controls of this food category. In the case of microbiological hazard now, there is a slight differentiation in the no brands, and in this case we wouldn't exclude analysis from our plan, just because we consider microbiological hazard as serious ones because of the immediate adverse effect they cause to humans, and therefore we would keep a small percentage of controls in our annual plans. What happens is that in these cases, we usually have data from other sources that imply that we should keep this percentage of samples, this number of samples. And also, it could be that the absence of non-compliances is because we haven't included this kind of analysis in our plans. So, in this case, again, could be data from different sources that imply that we should keep this analysis. Let's see what kind of data this could be. It could be information from the RASP system. It could be the data of other member states, the non-compliances that have occurred there. Also, during audits of DG Sanded, there could have been recommendation for conducting several analysis, and also ad hoc events like floods or fires may indicate that we should do some kind of analysis, as well as any political or social concern. This is, for instance, the case of genetically modified food. We have never had any non-compliances in this kind of controls, but because Greek people have a high concern, high interest for genetically modified food, we always include such analysis in our annual plan. So all these cases where we get data from other sources fall under the yes part of the decision trees. And for this In these cases, we plan a number of controls in our, we include a number of controls in our annual control plans. However, you can notice that there are several things missing, and the most important is the precise initial total number of different products which are available for consumers. This is not available. We don't have a register of the food products which are in the market. And also, even if we could have all the barcodes for products produced in Greece, we should also consider products originated from other member states or imported from third countries. One solution to this problem could be to use the number of food business operations instead of the number of products and just include one control for every food business operator, for every establishment. This could be quite right under certain circumstances and conditions. Let's say when let's say for bottled water, for instance, or for acrylamide, or just when only one production line or only one raw material or there is only one way for any hazard to enter the production procedure and be present to the final product. But this is not usually the case. The real life is more complex than this, so this is quite a problem. Also, in our planning, there are other obstacles or constraints present, and one of them could be the non-availability of official laboratory methods, at least in Greece. We know, of course, we can use official labs in other member states, but this could raise some other problems, like financial ones, or even problems in the transportations of the samples, because we should ensure the right conditions for the samples to get to a lab abroad. Just think about the laboratory controls of dairy products in a lab abroad. We should ensure the temperature and other conditions. So, for the moment, we know all these problems, but despite them, we are trying decently to do our best to protect our consumers' health. And because we know and we have addressed these issues, we hope that we may be able in the future to improve our methodology and maybe with also the contribution of scientists of different disciplines or even the academia or maybe the AI, who knows. We may be able in the future to just implement our national plans, which will be based on a perfect established risk-based tool. I would like to thank you for your attention, and I'll be glad to get your questions or comments.